In our approach, we did testing insofar as my genetic markers for the Healthy Weight DNA Insight, insofar as kind of a predictive model of what my particular DNA setup would be like for my health and wellness in the future. But more specifically, we did our food sensitivities test. And so with the food sensitivity test, and we did a diagnosis for where my vitamin levels were, we found out that I was in the tank, with the vast majority of a lot of critical vitamins, and a large reason of it being that that I'm eating a lot of foods that I'm sensitive to. So the vitamins were just passing through. So with all the things that we've kind of thrown at me, the change has been pretty staggering. To whereas I've gone from if zero is completely poor, performance, poor outcome, and 10 is off the charts, excruciating, and 50%, and 5 is like being right on balance, complete homeostasis. I think I'm really tacking around, the balance side. I'm not, a workout freak, because the dose that you give me for the testosterone is too low to go in there and get buff. So I'm not going to be buff. And, the HCG, I was thinking, I'm going to get skinny. No, I'm not going to get skinny. The dose you gave me was too low for that. So she's pretty stingy with, the dosage, but whatever. And I've gotten past the initial shock and depression from my long list of foods that I have a sensitivity to that, I really, really like. But the upshot, though, is the GI issues that I used to experience that were just horribly chronic and constant, and the like. I mean, just the bloating, the poor bowel movements, the whole 9 yards. That's pretty much almost completely resolved. That's been just a huge thing. So with the whole confluence of all the different approaches that we've attacked my quote unquote problems with, I'm really, really pleased with the overall outcome that's come about.
And this is what I really want to stress to you, is that you can't just go out there and get a treatment for your blood pressure. You can't get a treatment for your diabetes. You can't just go out there and get testosterone replacement therapy and think that you're going to be fantastic. And my approach is a little bit different than most people's approach, because, like you mentioned, I look at the whole wellness, whole holistic part of it. When you first came into the office, many people will say, you want to know about my sleep, you want to know about my sex drive, you want to know about erectile dysfunction, you want to know about what hours you work, when do you sleep, how much do you sleep? And I want to know the whole picture, because you mentioned a big topic. How many of you out there have fatigue between the hours of noon and 3? It is very common, especially in a town where you work this type of shift work and you're up all night, or you work from 3 a.m. to 3 p.m. It's not a normal sleep cycle. You don't get the release of normal sleep hormones at nighttime. If you're not getting the release of normal sleep hormones at nighttime, guess what? Your adrenals are going to be fatigued. You're not going to have the right cortisol levels. Your adrenals are fatigued. You're not going to have the right sleep hormones. You don't have the right sleep hormones. You're not going to have that growth hormone release at nighttime. You're not going to be able to lose weight, maintain muscle, have energy, feel good. Everyone should be able to wake up in the morning, not be searching for coffee or the energy drinks out there. At 2 o'clock, you shouldn't be looking for fast food because you're dying, or that simple carbohydrate.
But what if you like the fast food, Doc?
Yeah.
We look at that fast food.